Prevention is better than no cure. A doctor's visit. Hello there. What can I do for you?
Doctor, I've heard a lot about HIV, but I don't really understand what it is. Could you explain, please?
Sure. It's a very serious health topic. HIV stands for Human Immunodeficiency Virus. It is a serious virus that causes the condition AIDS. It can kill you.
What? Isn't there a cure for it?
No, unfortunately, there is no cure for HIV or AIDS. It can affect anyone, so prevention is the best defense. It is important to know the facts so that you can protect yourself and stop it from spreading.
Why is it dangerous? How does it work?
Let me explain it to you. Why is this dangerous? You see, a body is like a country with a defense system called the immune system. To protect the country from foreign attackers, every country has its own defense system organized with commanders and jawans. The commanders mobilize troops and maintain order among the jawans. Similarly, our body's immune system army protects us from foreign germs and infections. Our skin is like a strong wall that protects us from many germs and infections. Inside our body, our immune system commanders, also known as CD4 T cells, maintain order among the jawans to keep us healthy and fit. Our jawans follow all the instructions of the commanders to kill different foreign attackers. One type of foreign attacker is a virus. Have you heard of flu, measles, chickenpox, polio, or cold and cough? These are all illnesses caused by viruses. One of the deadliest viruses in the world is HIV, the Human Immunodeficiency Virus. HIV cannot survive in the air like some other viruses, and you cannot get it from the air. However, HIV is very powerful and dangerous if it enters somebody's body. This virus is dangerous because it is able to attack the commanders and destroy them. HIV starts multiplying and takes over the body. This is when the person is HIV positive. Without the commanders, the jawans do not know what to do, and therefore are unable to fight against any foreign attackers. Over time, HIV destroys so many commanders in the body that the immune system finally collapses. When this breakdown of the immune system happens, a person is said to have AIDS, or acquired immune deficiency syndrome. AIDS patients are so vulnerable to infections that even very weak germs can cause serious infections or death. A major problem in India. HIV is a global problem. India has one of the largest number of people living with HIV in the world. It is important to know all the facts so that we can prevent others from getting infected. HIV can affect anyone, man or woman, girl or boy, rich or poor, Hindu, Muslim, Sikh, Christian, or any religion. It can affect anyone. Of all the people in the world who have HIV, most of them do not know that they are infected. You or someone you love could have it. So it is important to understand the facts. Know the facts.
Is it easy to get HIV?
No, it is not easy. You cannot catch HIV from the air like cold and cough. Nor can you get it from food or water. You cannot get HIV from any animals, such as chickens or cows. It can only survive and travel through certain human body fluids. You see, all humans have fluids in their bodies. For example, tears, sweat, saliva, the liquid in your mouth. The virus can only be passed through 3 fluids. This is the 3-point mantra. 3-point mantra: blood, breast milk, sexual fluids.
Okay. What about the other body fluids? How do I know which ones are safe and which ones are dangerous?
Good question. Let me explain. How does someone get infected? Part 1. High-risk fluids. There are 2 categories of body fluids: the high-risk, dangerous fluids, and the no-risk, safe fluids. HIV can only be passed through high-risk fluids, which are blood, breast milk, and sexual fluids, our 3-point mantra. Blood is a high-risk fluid. The virus can enter from sources like blood transfusions, used razor blades, or used needles and syringes. Sometimes it can pass from a mother to child, while the mother is pregnant during childbirth, or through mother's milk. Blood and breast milk are high-risk fluids. HIV can pass through sexual fluids if they are directly transferred from an infected person to someone who is not infected. These are high-risk fluids. HIV cannot spread through any other fluids. It cannot spread through saliva. Saliva is a no-risk fluid. It cannot spread through mucus, like nose fluids or cough. Mucus is a no-risk fluid. It cannot spread through sweat. Sweat is a no-risk fluid. It cannot spread through tears. Tears are no-risk fluids. It cannot spread through body waste. Urine and stool are of no risk. How does someone get infected? Part 2. Direct transfer. Now remember, our skin is like a thick wall that protects us, and HIV cannot survive in the air. The virus must find a way to have direct transfer into your body in order to survive.
What is direct transfer?
Direct transfer can take place in 2 ways. First, direct transfer occurs through cuts or wounds on the skin that allow the virus to enter blood. These cuts can occur anywhere on the body. Or, direct transfer can occur through natural openings in the body like your mouth or your private areas. Remember, the virus cannot survive in the air like the flu or cold and cough. The virus is powerful only if it enters the body through direct transfer. So, how do you know if you might be infected? Use the triangle test. Step 1. Is there a high-risk fluid? If no, stop here. There is no HIV risk. If yes, proceed to step 2. Step 2. Is there direct transfer? If no, stop here. There is no HIV risk. If yes, proceed to step 3. Step 3. There is a possible HIV infection. Go see a doctor.
But I heard that you can get infected if someone with HIV or AIDS coughs on you. Is this true?
Now, let's look at the diagram again. This time you answer the questions through my doctor's challenge. Doctor's challenge. When asked a question, think of the correct answer. Remember the triangle test. Can you get HIV from someone sneezing or coughing on you? No, you cannot. Let's find out why. Are saliva and mucus high-risk fluids? No, they are not. Therefore, there is no chance of infection. You cannot get HIV from someone sneezing or coughing on you. Can you get HIV from sharing a needle with someone? Yes, you can. Let's find out why. Is blood a high-risk fluid? Yes, it is. Is there direct transfer? Yes, there is. There is a possible HIV infection. Go see a doctor. You can get HIV from sharing a needle with someone. Can you get HIV from shaking someone's hand? No, you cannot. Let's find out why. Is skin a high-risk fluid? No, it is not even a fluid. Then there is no chance of infection. You cannot get HIV from shaking someone's hand. Can you get HIV from a toilet? No, you cannot. Let's find out why. Are urine and stool high-risk fluids? No, they are not. Then there is no chance of infection. You cannot get HIV from a toilet. Can you get HIV from animals such as cows or chickens? No, you cannot. Let's find out why. We do not have to go through the triangle test because you cannot get HIV from animals or insects. You can only get it from humans. Therefore, there is no chance of infection. You cannot get HIV from animals or insects. You can only get it from humans. So, can you get HIV from hugging someone? No, you cannot. Let's find out why. Is sweat a high-risk fluid? No, of course it's not. Then there is no chance of infection. You cannot get HIV from hugging someone. Can a baby get HIV from breast milk? Yes, they can. Let's find out why. Is breast milk a high-risk fluid? Yes. Yes, it is. Is there direct transfer? Yes, there is. There is a possible HIV infection. Go see a doctor. A baby can get HIV from breast milk. Can you get HIV from kissing? No, you cannot. Let's find out why. Is saliva a high-risk fluid? No, it is not. Therefore, there is no chance of infection. You cannot get HIV from kissing. Can you get HIV from unprotected sex? Yes, you can. Let's find out why. Are sexual fluids high risk? Yes, they are. Is there direct transfer? Yes, there is. There is a possible HIV infection. Go see a doctor. Both males and females can get HIV from having unprotected sex. Can you get HIV from a mosquito bite? No, you cannot. Let's find out why. We do not have to go through the triangle test because you cannot get HIV from animals or insects. You can only get it from humans. There is no chance of infection.
But doctor, mosquitoes suck human blood. Why is there no chance of infection?
Okay, that's a good question. You see, mosquitoes are a special case. Let me show you why there is no chance of infection. Let's look at the triangle test. Is blood a high-risk fluid? Yes, it is. Is there direct transfer? No, there is not. Mosquitoes only suck blood. They do not inject it. Therefore, there is no direct transfer. Then, there is no chance of infection. You cannot get HIV from a mosquito bite or any insects. Just remember this as a general rule. You can only get HIV from humans and not from any animals or insects. Appearances are deceptive. The guessing game. Can you tell by looking at a person whether he or she has HIV or AIDS? Remember, appearances can be deceptive. So, who do you think has HIV or AIDS? Wrong. You cannot tell by looking at a person whether he or she has HIV or AIDS. Guess again. Who do you think has HIV or AIDS? Wrong. You cannot tell by looking at a person whether he or she has HIV or AIDS. One more time. Who do you think has HIV or AIDS? Now, wrong again. Now that's the point. Always remember, you cannot tell by looking at a person whether he or she has HIV or AIDS. An HIV-positive person can look perfectly healthy and work like any other person. They may not know themselves that they are infected. How do you know there is an infection? Some people show no physical signs of HIV or AIDS for many years. Others may show signs like fever, cold and cough, headache, skin rash, and sweat. But eventually, everyone who is infected gets extremely sick. Once HIV develops into AIDS, the symptoms are more severe. They become very tired, get sick, and lose a lot of weight.
But those symptoms are similar to cold, cough, and fever.
Exactly. Early symptoms are similar to cold, cough, and fever. And because of this, many people do not know that they are infected until they are very sick. If you have been involved with high-risk fluids with possible direct transfer, you should go see a doctor and get tested.
How do I protect myself from HIV?
How do you protect yourself? Remember our triangle test? In order to get HIV, you must have direct transfer of high-risk fluids. Blood. Do not share instruments such as razors, blades, needles, and syringes. These instruments may be infected with tiny amounts of the virus, which you cannot see with the human eye. Donate blood only to blood banks that use sterilized equipment. If you receive a blood transfusion, make sure that clean needles and HIV-negative blood are used. Blood and breast milk mother to child. A baby can become infected in the mother's womb during childbirth or through breast milk. But with the help of a doctor, a pregnant woman can prevent the transfer of HIV to her baby. She can still have a healthy baby. Breast milk, mother to child. If you are HIV positive and plan to have a baby, consult your doctor about the best way to feed your baby. They may suggest options like taking HIV medicine while breastfeeding, giving powdered milk, or using some other substitute. Sexual fluids. Before entering into a committed relationship, the couple should get tested for HIV. Remember, most people who are infected do not know. Your partner may not know whether he or she is HIV positive, so just get tested. Always use a condom. They can help prevent direct transfer of HIV when used regularly and properly. If you cannot use one because you're trying to have a baby, then you must make sure that both of you have been tested. Remember, the more partners you have, the more you are at risk. People who have other sexually transmitted infections or STIs are also at a greater risk of being infected by HIV. Make sure everyone has been HIV tested and uses a condom every time. Why is testing important?
I know why. There may be no symptoms, so testing is the only way to know if you have the virus. Plus, appearances can be deceptive, so testing is the only way to be sure.
That's good. That's very good. It is quick and easy to get tested. Go to the hospital, and they will check your blood or use another simple test. It's just like testing your blood sugar. Ask your family doctor about testing. If you do not want anyone to know, go to a public or a municipal hospital where you can get tested anonymously. Although there is no cure for HIV or AIDS, there are treatments that will help you live longer. With treatment, your chances of infecting loved ones are reduced significantly. It is important, therefore, to get medical help early.
Thank you for teaching me so much. I'm wondering, what can I do to stop the spread of HIV?
What can you do to help? Spread the message. And the message is, number 1, it is easy to protect yourself. Know the facts and share them with your loved ones. Number 2, go for counseling and testing and encourage others to do the same. Transfer of HIV can be reduced by being responsible. Number 3, making healthy decisions now will help ensure a healthy future. Everyone, including those with HIV or AIDS, deserves compassion. Join our team, and together we will teach others about HIV and AIDS. It will take all of us to make a difference. Let's work together.
हमसे ना वैसे वैसे पकड़ो ओहो ऑर्डर जनहित में जारी रहे अपनी लिमिट में रहो हेलो हेलो अब तो है अपनी बारी रे हमसे ना वैसे वैसे पकड़ो ओहो में जारी है, अपनी लिमिट में रहो। हेलो हेलो, अब तो है अपनी बारी रे। लिटल बिट झटका जिसे दिया वो लटका, फेमस होने